Hi guys, it's Maddie and this is my shoulder special test video. I hope you enjoy it. Thank you. This test, the patient will be standing. You as well will be standing. To perform this test, passively flex their head while applying a downward pressure to the shoulder. A positive test will be pain that radiates into the arm. For this test, the patient will be supine while you are standing over their test side. So to do this, you're going to anchor their arm into your hip, place one hand on the deltoid mass, and you're just going to make small and big circles with internal and external rotation. A positive test would be a clunk that repeats every single time you pass the spot. For this test, the patient can be seated or standing. You will be standing behind the testing shoulder. First, you're going to stabilize the shoulder and grasp firmly inside the deltoid. Then slide the humeral head along the glenohumeral joint. A positive test will be excessive movement in the humeral head. This test, both the patient and the practitioner will be standing. Ask your patient to touch their opposite shoulder and then push their arm into further horizontal adduction. This is the scarf motion of the test. A positive test would be pain, especially over the AC joint. For this test, both the patient and the practitioner will be standing. To perform this test, ask them to reach behind and touch the opposite scapula, and they can touch their hands together. And then a positive test would be an inability to perform this action. This test, both the patient and the practitioner will be standing. The first step for this test is to find the patient's radial pulse. Then you're going to move their arm into 90 degrees of abduction. And then for Addison's, you're going to have them look at their abducted arm, take a deep breath in and out. And for Allen's, you're going to have them look away and take a deep breath in or out. A positive test would be absence of radial pulse. For this test, both the patient and the practitioner will be standing. Ask the patient to flex their shoulder to 90 degrees, and then you're going to internally rotate their arm. Apply a downward pressure on their wrist, and then ask them to have their hand in a neutral position and apply a downward pressure as well. A positive test would be pain and or clicking with the first one, but no or not as much pain and clicking with the second one. This test requires both the patient and the practitioner to stand, have them abduct their shoulders to 90 degrees, and then flex the elbow to 90 degrees. Have them rapidly open and close their hands while maintaining this position for 3 minutes. A positive test would be an inability to perform it. For this test, both patient and practitioner will be standing. Have them abduct their arms to 90 degrees. Tell them to slowly lower it to the sides. A positive test would be an inability to slowly lower their arms. For this test, the patient will be supine and the practitioner will be standing. To complete this test, abduct their arm and secure it under your armpit. Place one hand under the shoulder. The other hand will be on top of the shoulder. For anterior drawer test, apply an anterior force, and then for the posterior drawer test, apply a posterior force. A positive test would be increased motion or pain. For this test, the patient will be supine. You will be standing on the test side, bring their shoulder to 90-90, then externally rotate their shoulder. Once you get to the stopping point, push on the humeral head and crank back, then release the pressure. A positive test would be pain. In this test, the patient will be seated while the practitioner stands. Have them flex their elbow to 90 degrees and supinate their fist. Place 2 fingers on bicipital tendon and apply pressure. Have them uppercut while you resist their movement. A positive test would be pain, especially in the bicipital groove. For this test, both the patient and the practitioner will be standing. To perform this test, put your hand on the top of their shoulder, ask the patient to raise their arm and slowly lower it down. Repeat this on the other side, and then a positive test would be pain reported over the lateral aspect of the shoulder. For this test, the patient is supine while you are standing next to their affected side. So the first thing you're going to do is you're going to anchor their elbow into your armpit, and then you are going to apply an anterior force, and you're going to stabilize the elbow while you're doing this. A positive test would be pain. For this test, the patient will be seated while the practitioner is standing. Have their shoulder at 90-90, stabilize the elbow and the shoulder, internally adduct their arm in a wave-like motion. A positive test would be pain. For this test, both the patient and the practitioner will be standing. To perform it, Place the back of your hand on the patient's abdomen and ask them to push on your hand while you resist their movement. A positive test would be noted weakness from their force. For this test, the patient is seated while the practitioner is standing. To perform this test, have the patient bring their arms in so that their fists are touching each other. Then, you are going to apply a downward pressure on their elbows. A positive test would be noted weakness or pain. For this test, both the patient and practitioner will be standing. You're going to put your fingers on the scapula and clavicle and the other hand on the elbow. Then you're going to apply a downward force to the humerus or pull down, and a positive test would be a visible step-off or deformity. For this test, the patient and the practitioner will be standing. The first thing you're going to do is ask them to get into a push-up position on the wall. Then you're going to ask them to protract and retract their scapula. A positive test would be winging of the scapula. For this test, the patient could be seated or standing while you are standing. You're going to have them flex their shoulder to 90 degrees, and then you're going to place your fingers on the bicipital groove and apply a downward force and have patient lower their shoulder. A positive test would be pain or point tenderness. For this test, both the patient and practitioner will be standing. To perform this test, place their arm on top of your shoulder, and then you're going to apply an anterior and inferior force through the humeral head. A positive test would be laxity and or noted weakness. For this test, the patient can be seated or standing while the practitioner is standing. To perform this test, apply a downward pressure on the distal end of their clavicle and slowly move up. A positive test would be noted displacement compared to the other side. For this test, both the patient and the practitioner will be standing. To perform it, you're going to have the patient abduct their shoulders to 90 degrees, and then you're going to bring their arms in about 20 degrees. To perform the full can test, you're going to ask them to have their thumbs up, and then you're going to apply a downward pressure on their wrists. And then for the empty can test, you're going to have them point their thumbs down and apply the same downward pressure. A positive test would be pain and or weakness over the supraspinatus. Thank you so much for watching my videos. I hope you learned a lot, and goodbye.